ultrasound of foot and ankle. This is how the patient will be lying. The right side of the patient on couch, the patient will be spine. We have divided ankle sonography into 4 parts. So there, as we have 4 compartments of ankle, the anterior, posterior, lateral, and medial. We will see different structures in ankle and foot, which include muscles, tendons, ligaments, synovium, bursae, nerves, ganglia, and other masses. Examination is customized according to clinical findings like extensor tendons, we have peroneal tendons, then we have the back, which is the flexor tendons. If you look at the posterior ankle, we have the strongest tendon of the body, which is Achilles tendon or tendo Achilles. And just below it here is the retrocalcaneal bursa. Here is the foot. Another important structure is plantar fasciitis. The plantar fascia, its abnormality will be the inflammation of the fascia, which is called plantar fasciitis, usually seen in those who are gaining their weight quickly or using higher heel of the shoe. This is the posterior ankle. You can see here, you can see the Achilles tendon, tendo Achilles, and this green area indicated here is the bursa, the retrocalcaneal bursa. This is how we scan the posterior of the ankle. Head is upward, going up to the heel, the calcaneus. Let me show it again. A lot of gel is used, the linear transducer with 7 to 10 megahertz frequency. Achilles tendon, the extension of the 2 heads of the gastrocnemius and soleus muscles. Achilles tendon does not have a rich blood supply. It is not invested within a true tendon sheath. A paratendon composed of fibrous tissues surrounds it. So here we can see the longitudinal view. This is the width, and these are the fibers, subcutaneous fat. This is the tendon. Here is cut section of the tendon taken in the transverse view. So you can see it is a broad tendon. And the longitudinal fibers are evident that it is fibrillar in pattern. This is how it is scanned, the longitudinal view and transverse view. The tendo Achilles, another view, the cut section, and whole of this is the longitudinal view of the tendo Achilles, normal. On panoramic view, we can see this is calcaneus, Achilles, a tendon is here, and here is the bone, and this is attachment of the tendon. We can get some pathologies here in some of the cases. So panoramic view, you can see it, and then is the muscle, soleus and 2 gastrocnemius, and the tendon is called Achilles tendon. This is the area of retrocalcaneal bursa, and sometimes we can have an anisotropy whenever a structure is rounded we can get some shadow, which will go away by changing the angle of the transducer. It is usually seen around the rounded areas like the head of femur or at rotator cuff in shoulder.